Back to the lead in national news. Vice President Joe Biden met with Newtown families and mental health advocates today and announced $100 million in federal funding to improve mental health services. This just 4 days before the one-year anniversary of the tragic shooting at Sandy Hook Elementary. I want to bring in Chief Medical Correspondent Dr. Sanjay Gupta for more. Sanjay, good to see you. Thanks for being with us. So $100 million, what specifically will that money be used for?
Well, it's interesting, Jake. $50 million of it's coming from the executive branch, from the Department of Health and Human Services, and that is specifically to help hire more mental health professionals, create community resource centers, which could help free up some beds, and address issues like substance abuse. What is interesting is the other $50 million is in fact coming from USDA through one of their services programs in the community. And the reason for that is that they want to make sure that there's a focus on rural health as well, which gets even shorter shrift with regard to mental health than other areas of the country. So they're going to focus on rural areas, building up some of the resources there, including, again, the hiring of new staff, but also focusing on telemedicine. This idea that people, mental health professionals in one community might be able to provide services to underrepresented, underserved communities as well. So $50 million HHS, $50 million USDA.
USDA, of course, standing for the U.S. Department of Agriculture. Sanjay, what else is the administration doing on mental health? Because obviously today's announcement just one piece of a much larger puzzle, and $100 million in the scheme of things, not actually all that much money.
Right, at the federal level, I agree. And, and part of this has been, as you know, Jake, this has been a push overall, coming out of the Vice President's office, looking at violence and gun violence specifically. So this is part of that broader mission or that broader push from the Vice President's office. But with regard to mental health, you'll remember back in 2008, there was a mental health parity bill that was passed, which basically says, let's think of mental health on par with physical health, everything from your co-pays and your deductibles to the fact that you would classify mental health as an essential health service in the way that you would classify physical health. That didn't really get teeth until just a few weeks ago, November of this year. So almost 5 years later is when they actually said, okay, these parity things are now going into effect. So that's a bigger push. There's also this idea that just like you can't discriminate against people based on pre-existing physical conditions, you can't discriminate against people based on pre-existing mental health conditions either. And we already sort of knew that, but that's also been part of what we're seeing with this Parity Act. I will say that, look, when we talk about parity, none of it really works unless there's enough resources, enough staff, enough beds available, and that we just don't have that right now in this country. Some of this will help in that area, although, as you point out, a small amount. A significant amount is going towards research overall, a couple $2 billion coming out of the Affordable Care Act dollars to actually target new potential treatments and even earlier diagnosis for mental health.
And speaking of beds not being available, we all remember a few weeks ago when former Virginia gubernatorial candidate Creigh Deeds, his son attacked him and then shot himself, his son having been turned away from a mental health facility. Virginia Governor Bob McDonnell today announcing some new mental health initiatives in the Commonwealth of Virginia. His successor, Governor-elect Terry McAuliffe, applauding the efforts. This is really where a lot of the real change is going to happen, though, right? At the state and local level. What can you expect to see? What are you expecting to see and hoping to see on the state and local level?
Let me give you an idea of how big a turnaround this is, Jake. Between 2009 and 2012, it was mental health budgets at the state level were basically decimated, really gutted. More than $4 billion in cuts over that time period between 2009 and 2012. So this is playing a little bit of catch up, but also represents a huge turnaround. And you're absolutely right, because again, you can talk about parity all you want, you can talk about initiatives to reduce stigma, but unless people can get services they need, the mental health professionals are available, none of that really makes a difference to people who are suffering right now. And at the state levels, the local levels, where you're going to see that. There was 37 states, Jake, that actually increased their budgets for mental health overall, including Texas, actually the biggest, $259 million over the next 2 years. And remember, your audience will appreciate this, but that's not because of Medicaid expansion in Texas. Texas is not expanding Medicaid. This is a decision by the states to do this. And again, a huge turnaround. I think no question after Aurora, after Newtown, after a lot of what we've seen over the last year, it's caught everybody's attention. And as much as we've talked about guns, mental health is something that people are focusing on as well now, thankfully, and even at the state level.
And we hope it will make